Thank you, Presiding Officer. To ask the First Minister what assessment the Scottish Government has made regarding the level of opiate addiction.
First Minister.
Achieving a comprehensive picture of addictive opiate use can and is challenging, not least due to the nature of illicit drug taking, and that means that there will always be a degree of estimation. I know that Dave Stewart has raised the issue before of the impact of addiction to prescribed opioids. These are very legitimate concerns due to the potentially highly addictive properties of these medicines, and these concerns were reflected in both our chronic pain strategy and refreshed our polypharmacy guidance published last year. Through the National Therapeutic Indicators, we are monitoring the numbers being prescribed strong opioids over a long period, and this is informing the establishment of the Chief Medical Officer, by the Chief Medical Officer, of a short life working group examining prescribing trends in Scotland.
David Stewart.
Will the First Minister join with me in congratulating the Sunday Times for their first-class campaign highlighting the marked spiral prescriptions for opiates and the serious associated problems of addiction and overdose? Opiates contributed to 815 drug deaths in Scotland in 2017. Does the First Minister share my serious concerns that addiction created by super-strength opiate painkillers, which have a dark side and can ruin lives every bit as much as illegal drugs?
First Minister.
Yes, I do share that concern, and I would congratulate the Sunday Times and others for raising this important issue. Opioid prescribing can be appropriate for short-term pain if that is part of an evidence-based clinical decision, but for longer-term pain, clinicians are and should be advised to discuss alternatives with patients as part of a quality primary care prescribing strategy. We published our first chronic pain strategy last year, and one of its aims is to tackle the issue of over-treatment. As I said, the Chief Medical Officer for Scotland is convening a short life working group of experts to examine prescribing trends in Scotland, which will complement work being undertaken by Public Health England on the evidence for dependence on and withdrawal from prescribed medicine. So these are important issues, and it's important that we take them seriously, and I give an assurance today that the Scottish Government and our clinical advisors will continue to do so.